Good morning. Welcome to my presentation on how self-silencing impacts women's health. As you can see in the presentation attached, I have a picture of four women. These women are featured on the Government of Canada website with their stories on how they've worked to increase women's access to health and women's rights across the world. Just briefly, I'm going to speak to the story of the lady on the far left. Her name is Vivian Afam Bassi, and she works in rural areas in Nigeria for women's rights. Some of the work that she did convinced her father that she would never marry. And as I go along explaining how self-silencing works with women, one of the things that you'll often see is that there are ideas around women's rights and women's personalities and behaviors, and what's allowed and isn't allowed when it comes to how women are to speak, behave, feel, and exist. Because of some of these rules, some women are at risk day in, day out of something happening to them that's very violent or social stigmatizing or even dishonoring for their family because they're not behaving within these structures. This woman, as well as the other women pictured here, are women who you will find are going through this situation in their lives where they have had to fight very hard if they're going to have any rights to speak up for themselves and the other women that they're speaking up for, because they're going against that norm. What does self-silencing mean? What I'd like to say about self-silencing and what it means. In taking a deep dive into the research, what I found is that self-silencing is a strategy often used to maintain relationships and protect one's feelings, thoughts, emotions that don't fit the popular acceptable conversation. Self-silencing is deeply connected to self-sacrifice, self-betrayal, and suppression of feelings and thoughts, and an inability to be included in decision making, even when it's someone's life and healthcare situations. They're often formed by having these self-sacrificial behaviors that happen during childhood experiences of psychological abuse and the negative consequences socially and emotionally for displaying emotions that are considered inappropriate or unacceptable to the situation. When we look at the ACEs questionnaire for adverse childhood experiences, a lot of the women who have emotional inhibition have difficulties expressing themselves because they've had experiences in the past that have been incredibly stressful and traumatic, which have led to them silencing themselves to avoid this happening again. There's an association with depression, anxiety, and consequences that over time become increasingly debilitating relating to self-silencing in women. These women have learned to censor themselves, accommodate, and not value their own experiences and repress their feelings in the hope of maintaining relationships and coping with situations that could develop into being unsafe for them and where they may be socially shunned or not meet societal or family experiences. Self-silencing becomes a cognitive schema that they develop in social experiences to make themselves malleable, amenable, and acceptable to those closest to them and those around them. Self-silencing being formed and how this happens, some of the aspects related to social norms and gender roles have a large part in this. One of the things that I was able to get a handle on was the fact that women often have this prescription of how to be a good woman or what are considered to be, in the research, feminine traits versus masculine traits. These good women traits are all about self-sacrificing, pleasing others, and silencing the self so that relationships socially and emotionally are smoother and go along better when one isn't honest about a differing view or opinion. When I looked at the traits that make someone feminine, they are all about being passive, being attractive, and being able to deny oneself to make others happy and not using one's voice when it could cause any conflict or not align with what others want. When I came to the cultural norms and expectations, women were to maintain relationships by self-silencing themselves and restricting their voice and lowering their power in the relationship, which oftentimes led to depression and other health issues that I'll talk about as we go along in the presentation. For women, this externalized self-perception with having others define how they're to be, if they're to be deemed acceptable, and who they're supposed to be and how they're supposed to feel is deeply connected in the literature to high levels of depression and oppressive symptoms. It was interesting because for the women exhibiting the self-sacrificing in the self-silencing, they were becoming depressed. Still, there was literature showing that men having higher levels of self-sacrificing action had lower levels of depression. It got me thinking about the fact that potentially the reason that the men benefited from the self-sacrificing versus the women and didn't become depressed was because in many of these cultures, the women didn't have a choice. Whereas for the men, choosing to be generous and sacrifice the self was something they felt free to do. It felt like something that they could give as a gift because they had the freedom. Whereas for the women, it felt like they didn't have that choice. So when we look at pleasing others and being compliant in these cultural norms for women, I found several interesting aspects in literature. One of these things was that Greek Americans, there was less self-silencing than in women in actual Greece. And Asian Americans had higher self-silencing scores than the Caucasian Americans. Black women were part of this marginalized identity that felt that if they were speaking up, they would be discriminated against and seen as being loud, or someone using the term, some of the women were using the term ghetto, and that they were going to be falling into this Black female stereotype. They didn't want to fall into the trap of being discriminated against by speaking. Hispanic women talked about self-sacrificing in association with having a lower sense of self-esteem and self-efficacy, to the point that in some of the studies, they contracted HIV because they did not feel they could negotiate for safe sex. Women migrating from other countries to the United States, self-sacrificing was about feeling intimidated and unfamiliar in the environment and not understanding where they might have rights. These women reported feeling unsure about how to belong and be a part of things, and the lack of knowledge of their rights and how to participate held them back. Oftentimes, this theme of migrating to America was connected with higher levels of self-silencing and coping mechanisms of trying to avoid any discrimination and feeling very uncertain about their lives and futures. But these gender characteristics that were seen throughout the literature were about being deemed feminine by being affectionate, dependent, sensitive, keeping silent about problems, not exposing errors or issues from the opposite sex when participating in relationships, feeling under pressure to fit the feminine ideals and norms in the culture, trying to be positive influence that's submissive and fits in with the themes of most of the cultures. Traditional gender roles for women were about being quiet. The decision for women to self-silence was strongly motivated by values and beliefs inherited from family members, particularly female family members, and related to religious values, family cohesion being prioritized, marriage being seen as lifelong commitment, even when there's domestic violence and abuse, and protecting bonds at your own expense, avoiding any conflict in the family or the sense that you were being disloyal. Protecting the feelings and emotions others was primary before meeting your own needs. What are the consequences of self-silencing on women? Some of the consequences I was reading about in the literature include anguish that women carry beyond the immediate moment of self-silencing, losing the ability to recognizing themselves, losing self-worth, not being able to express themselves or their preferences regarding their rights and choices in sexual situations, a decrease in their self-esteem and self-respect, a growing sense of resentment and anger, alienation from loved ones. And in the health aspect, there were connections to fibromyalgia, irritable bowel syndrome, chronic fatigue, depression, anxiety. As I mentioned before, there was an association with fibromyalgia, self-sacrificing behaviors, and women repressing their needs and emotions to preserve personal relationships has a negative impact on their health, which is paramount to understanding some of the issues that come across a health provider's radar when discussing with women what they're feeling and experiencing, not just mentally and emotionally, but physically. There was a unifying theme across the women, self-silencing in various cultures for various reasons due to a lack of personal power, and this emotional suppression led to their greater vulnerability to depression. With these higher rates of depression related to self-silencing, there was an external self-perception and definition of the acceptable self given away to others. There was many consequences on their health from this. The situation where they felt they had to be something different or feel something different than they did, self-silencing in the literature impacted further their diet, their physical activities, and other health behaviors. And using this external negative self-judgment diminishes the sense of self and leads to depression. This divides parts of self into acceptable and unacceptable. The Suppressing negative emotions has many negative health consequences. Women are often only allowed to express the emotions that satisfy the good woman cultural standard, as the feelings that cannot be expressed mean that many emotions are unexpressed and are expressed through the body in the form of physical health issues. The stress and the distress get expressed in other ways. A particular aspect of interest is the aspect shared here in this slide about caring as a form of self-silencing. We think of caring as being such a wonderful thing, such a positive thing. Still, I want to emphasize that this idea of self-sacrificing and caring when it comes to assisting others sometimes is more about power in a relationship. For men, when it came to caring for others and silencing their needs, it was a way that they were able to have some positive social collateral, power and autonomy in relationships. Whereas for women, when it came to self-silencing with care, there is this social aspect where these women caring for others diminished their power. And this prioritizing of others led to neglect to themselves and their own needs, as well as them being seen as being in a lower social position in others' minds, interestingly. When we talk about women and girls developing their identity, one of the things we need to think about is society around them sets rules for individuals to guide them in how to behave and form their gender norms. This forms expectations regarding their identities. How identity is formed can be a passive process in terms of social and emotional relationships and taking in those expectations and passively forming your identity from them, or it can be an active process of constructing identity. Identity is very much formed in social emotional relationships, and developing identity is often supported as an active construct when it comes to careers, education, choices around leaving home, choices around marriage, if there is choices, and becoming a parent, if that's a choice as well. These kinds of opportunities for self-exploration help women to have a more active role in constructing their identity. In the beginning days of life, girls have more passive identity construction, where their identity is formed in expectation of family, society, others, and imitating other girls and women. To actively construct identity, there needs to be cognitive activities that allow someone to be autonomous agent regarding their evaluation of their gender roles. Identity for women is often formed in compliance with others, and others set up these relationships from a very young age. So when these relationships are set up in a way where they experience identity as being determined and positively influenced by self-silencing, this can affect their ability to use their voice. Personal expressiveness determines whether patterns regarding our formation of identity are successful, and if they're done in an active way, or whether identity is in relational struggle with others and requires suppression of the self. Interestingly enough, there was a study done that those who had more androgynous gender schemas, more androgynous meaning that female, rather than being strictly female trait oriented as a born female, they also had male trait orientation as a woman. They were more highly adaptable and had the capacity to determine which gender trait may give them the best adaptation to the situation they were in. So when they'd encounter a situation, they had this flexibility to exhibit the necessary gender typing that the situation required. It's interesting as we know that changes in identity and gender and how people are forming them, especially young girls, have been hot topics in many arenas. This idea that individuals becoming more androgynous are actively investigating their gender type and being and their decisive attitude towards who to be and how they'll be, and actually maybe a healthy way of forming identity is very interesting. So developing an active or constructive identity compared to those who are more passive and follow traditional girl or female gender stereotypes. Suppose women perceived others as more important than themselves. In this case, self-sacrificing is used to maintain relationships. As we've mentioned before, there's impacts physically, psychologically, and emotionally. For one to feel secure, sometimes one feels they need to self-betray and self-silence and sacrifice the self. There are many wide-ranging negative health implications from this. Speaking about actively engaging the development of identity, Identity can be formed in a relational struggle. When someone is struggling internally with their partner, their family, or society's imposed ideas about the girl or woman that they should be and how they should feel or not feel, it doesn't allow the woman to answer the question of who they are or what they feel. In these situations, women form their identities without listening to their voices and without feeling that their voices matter. Actively engaging identity allows individuals to be independent, autonomous, have the ability to structure things for themselves, have a say in things, and express themselves. This passive engagement, often the case for many women around the world in various cultures and lives, is a result of obedience and imitation of the women around them and is learned that it is more acceptable to be silent. Active engagement identity involves individuals making cognitive efforts to attempt to develop their identity in various ways by trying out different behaviors, exploring different thoughts and different views, and working through their active construct of identity by exploring these alternative identities and trying them out in various situations to see what makes most sense to them. As far as how they are forming their identity, it's an active process. They find their voice, they feel their voice matters, and that they can take autonomous action in situations with others for themselves or on their own for themselves. These new thoughts about the self that are presented in a relational contact or an educational setting can often be constructive in exploring identity. Exploring learning experiences, exploratory learning experiences offered in work and school and other leisure and recreational activities can be incredibly meaningful to the emerging girls and women's development of identity. The model of identity that we're working from in this literature that I've been reviewing is about the individual identifying with society, family, and other systems that exist and recognizing alignments or misalignments with their internal way of being and what makes sense and feels right to them and their identity in their self versus not. Identifying with gender roles determined by society, systems, family, cultures, or religions that don't match the internal state of the individual, something that causes considerable distress in their health, physically, mentally, and emotionally. Identifying with gender roles that are determined by society increases their socialization, their social acceptance, which is often the reasoning women give for self sacrifice and self silencing because they feel they have no choice but to conform to societal norms. They need to self silence, self sacrifice, and self betray to belong. How do we help with this? How do we work as health providers in supporting women to overcome this self silencing? For us to help women getting their needs met in this very sacred space of healthcare, where they're coming and need to feel that they can be vulnerable to express themselves, we need to understand the barriers that may be in their way to expressing these needs and how they may be self sacrificing and self suppressing and betraying themselves in the context of the systems they live in, whether it's religious, socially, emotionally, morally, the feminine traits they feel they need to identify with, the traditions they comply with, and their diverse cultural context and intimate relationships. So if a woman is in a situation where they haven't been able to develop some of these masculine traits of autonomy, independence, and entrepreneurial spirit and enterprise, the inner association that comes with it is not something they're familiar with. And these traits in the literature are considered masculine traits. And so the strength to speak out may be incredibly difficult for them. It may require them to get past these feminine traits of being seen as compliant, attractive, dependent, compassionate, and putting others first. We need to recognize how it feels to them as they're shunning their family in their own mind and embarrassing their family and speaking in a way that could lead to implications for them within their family or your own office in their own mind, and be concerned about how this might have a negative outcome for them with their healthcare provider. They may be hesitant to open up. For women to be able to exercise their self-awareness and recognize their needs is maybe something they're very unfamiliar with because oftentimes self-silencing behaviors are linked to self-neglect and a person's needs not being met or even recognized within the self. For these elements to be in place for a care provider to support women in overcoming self-silencing, there are specific things that you're going to need to do in your healthcare and your healthcare setting to nurture the relationship and the space for them to feel that they can go beyond some of those traits, that those traits that are there for survival and to protect themselves and their families that go against voicing their needs. Part of this is going to be creating an environment where it is expressed that is the norm for them to have a protective, confidential space without impact or implication on their family culture or home life, a place where they can speak and the effect is being considered on them and understanding of why they may not want to share something. It's recognized and understood. Understanding the aspects that we've talked about in the session today is a massive piece of that because to provide patient-centered care, you need to have a listening lens that understands the social, cultural, and identity context for each person in your care. If this girl or woman is impacted in these different ways of approaching getting their needs met, the care being provided needs to involve overcoming any barriers and working to remove those implications and consequences to them of sharing. We do this by fostering this open communication and asking them questions about the context of their life and their responsibilities and maybe normal feelings like being scared to share, voicing that they may be suppressing their needs and your understanding of the valid reasons why that might be the case for them, with your desire to create safety and their desire to protect their family's image or relationships and acceptance of them being able to speak in a way that they have learned is allowed and acceptable. That they'll be seen in their vulnerability as expressing their stress and personal experiences without those implications on their family happening outside that room, unless, of course, there's a safety issue and consideration. But letting them know that you'll work to be in a position to advocate for them and get their needs met by having cultural sensitivity, providing that advocacy where there are barriers for them in doing this for themselves and supporting them through the process. Possibly having those who may speak their language or be a part of their culture on your team, or having access to those individuals when you need them in your practice to support, and being aware of whether they would like to meet with someone who's a part of their culture, or if that's going to make it even harder for them to speak up, whether they'd prefer to have somebody outside of their religion or cultural context to feel comfortable saying things that they know might be heard with less judgment by someone who's not a part of their community. So, considering their situation, allowing the opportunity for them to understand that you would like them to maintain their dignity and avoid shame and avoid self criticism and provide access to whatever supports you can for them is incredibly important. It also becomes vital for them to be able to be educated on resources that are available because sometimes self-silencing is about not knowing how to get help when it comes to therapy, lawyers, healthcare, all these different areas where they may need additional support and resources to actually be able to make changes in a particular area of their life, or even understand that there are changes they can make or support that might even be available that they had no idea about. So all of this is to say is that there is a context that needs to be understood for that individual, socially, emotionally, and otherwise. We must take the time to express our sensitivity to that context and our understanding of the various reasons they may self-silence. It may be difficult for them to express what they need or even know what they need, and they may still fear the consequences of expressing. So, working to create that safety and that space and that relationship over time of trust is so incredibly important to those in our care. If you'd like a deeper dive into the literature and where my information came from, where to find it, how to follow up with it for your own interest and understanding, I do have notes with each quote and where it came from, as well as these references. And I'm absolutely happy to share and spend time with you outside this session to support with that process. Thank you so much.